Toine, welcome. I'm very curious about what you're going to talk about today. Who are you and what topic are we talking about?
Yes, thank you. I'm Toine. I'm a denturist in the Netherlands, and I work with a lot of edentulous people for I think for 25 years at this moment, and I treat a lot of people with dentures.
Interesting, and you're also teaching?
Yes. I'm teaching younger people in our practice, and also I'm teaching dentist at the university in Amsterdam.
Great. So what topic are we talking about today?
We will talk about a soft relining material under dentures.
Under dentures. Okay, so in which cases and which patients are we using soft reline? As I can remember, in practice, I don't do a lot of dentures, but I do practice a lot of prosthetic treatments, but not especially just dentures. But what I remember about soft reline is basically you're using it just for 3 to 6 weeks. That's pretty much it. So, what's your opinion about it?
Yes, of course, you can use it for 3 or 6 weeks, but also you need it sometimes for a year or longer. And at this moment, we look at the materials we can use longer than 3 to 6 weeks. And we treat it when patients have bone augmentation, when they are implanted. When we have older people who don't have the quality of bone, you can implant. So you have to use some other materials.
So improve the function.
Yes, improve the function of the denture. Yes.
Okay, so this means it's we can use it in multiple different situations.
Yes.
That's what you're talking about, right?
Yeah, we can use it under full denture.
Also on a partial.
Also partial dentures, also implant dentures. Yes, and you can use it in upper and lower denture.
Okay, so what kind of functional improvement are we talking about? So is it just the fit, or is it also chewing or pain or?
Yeah, all the things you are you say. It's less pain. The fit of the denture will be better. When you chew, it's a better
distribution of the forces.
Yes.
Okay, so we're building like a soft sole inside the denture.
The denture, yes.
Okay, great. So that's really great. So you are saying it's not just for 3 to 6 weeks. So
No.
What kind of time or what kind of period are we talking about, or are you talking about?
Yeah, at this moment we can say some patients we can treat with them for 3 years.
3 years?
Yes.
That's really different than my 3 to 6 weeks.
Yes, and that's because of better materials at this moment.
Okay, so what kind of material? Because I'm used to use like a basic pink soft reline, which is, in my opinion, it works well maybe under 3 months, and then it becomes brittle and it doesn't really work that well anymore. It becomes painful.
Yeah.
So what kind of material is this? Because this seems different.
You have several brands, and you have silicone-based and PMMA-based.
Okay.
I used a silicone-based Mucopran Soft, and you know for sure it will take very long before you have to redo it.
Okay, that's great. That's good news.
Yes.
For all the practitioners in the office. So when it comes down to the procedure, like the actual procedure, what are the steps?
You take out the denture. You take out 2 millimeter of denture material of the inside of the denture. On the outside, you make a rail, and after that, you have to bring on adhesive, and you have to dry that for 30 seconds to 1 minute.
Until it's dry.
Until it's dry.
Okay.
After that, you bring on the silicone material, and you take it into the patient's mouth. You make functional movements, and after 6.5 minutes, the material you can take it out, and then you have you can use a knife or scissors to remove all the material you don't need.
Also scissors.
Also scissors.
Oh, that's
yes.
great. That's great. So even not so handy people can use this
Yes.
soft reline, as usually it's very difficult to take it out, right? Because the PMMA material, as I think this must have been PMMA, which I was using.
Most practices, they have PMMA material in their practices, yes.
So what are the benefits from PMMA or silicone material compared to PMMA? So we talked about durability already, but then there must be difference.
When you look at the silicone materials, they stay soft, and they stay very resilient.
Yeah, resilient. So they stay in the same position.
When you look at PMMA, they lose their softness, and they crack, they get rough, and you don't see that with silicone materials. So for patients, it will be better to use silicone materials instead of PMMA.
Yeah. So it's the durability is way better.
Yes.
Because it will stay there, and up till 3 years.
Up to 3 years.
Okay,
yes.
That's great. That's really good news. So, how much time would it take in the office to do it at chair side?
I think half an hour.
Half an hour. Okay,
Yes.
that's not
To do it on the right way.
To do it the right way. Okay, so for us who are less practiced than you are, so probably 45 minutes, which is okay.
Yes.
Okay, but then we can at least we can increase the possibility for the patient to really wear it for such a long time.
Yes. Yes.
But then you talk about the advantage of silicone compared to PMMA. Also something about the brittleness or the porosity on the inside, which in PMMA it will lose the ability to stay resilient, right? That's what you said.
Yes. Yeah.
So then, how does the silicone actually becomes this soft and smooth?
Yeah, it's because of the materials who are used in this silicone.
Yeah. So
And
is it just the silicone, or is there also an extra layer on top of it to make it?
Only when you have worked it out, then it's a little bit rough.
Okay.
Then you can, on the upside, you can smooth it with a thin, soft material.
Okay, great. So that's the final layer.
Yes.
Okay, so then that's the real difference, because that makes the layer of the durability, but also the hygiene.
Yes. Yes. Yeah. Because it has no roughness. You don't have
All the accumulation of all the plaque and all the dirt coming in.
and all the materials.
Yeah. So that's also a big benefit compared to PMMA.
Yes. Yes. Of
So
course.
then you would also use this as a more permanent solution, also
Yes.
for people in elderly homes.
Yeah. You can use that because when it takes there for 1 year, 2 years, 3 years, instead of PMMA, you have to remove every 8-9 weeks. Yeah, it's a lot of time. It's a lot of visits in your practice.
It's also a lot of effort for the patient to
Yes.
come in and out.
Yeah, just one visit and help them for a long time.
Yeah. So then, when we talk about precision anchorage or telescopic prosthetic solutions or partials, how does it work? Because for me it was also very difficult to maintain the soft reline at the right position. So that's, for me, it's quite a difficulty to apply it.
Yeah, when you talk about implantology, or when you talk about conus constructions, yeah, you can use it when you are making that construction, and you can use it in the old denture, so it will fit and it will not loosen at the patient. When you talk about partial dentures, when you talk about people who have just 3-4 teeth and you are building up that, then
so
you can use the
end
undercut.
stage of the teeth, then we can also
then
use
you can
this.
use the undercut, and then you have some retention for the denture.
Okay, that's really good. So the final, because I think we've covered almost every topic of this soft reliner. Aside from the chair side, which is like half an hour or 45 minutes, which is way better than coming in and out of the office for 6 times, what are the rest of the benefits for using the soft reline material for the patient? So it's also it's time and it's money, but it's also what is the real benefit? Does it fit better, or can we chew, or can we do everything?
A patient can chew better. The fit is better, and the patient says, okay, now I don't think about my denture. Now I go out with my friends. I go to a restaurant
instead of my
yes.
denture. Okay, that's great. So the final part, because you just told me about the implants, I would worry with implants, how does the healing proceed when you're adding silicone material to your denture?
That's no problem, because when you're adding those material, then you see that the forces of the chewing are all over the jaw and not just at the implants. So it has no negative
Side effect.
side effect for implants.
Okay.
And it's more positive for the patient because he can wear his denture
Yeah, for sure. Because then you're not teethless during the day.
several weeks. Yeah.
Yeah, for sure. And then, so we talked about chairside, but can we also do this via laboratory or?
Yeah, no problem. You can choose for indirect methods, and then you make a relining impression. You send it to your laboratory, and the laboratory can do it. In
the lab.
In the lab.
Okay, so it's a silicone. It's better for the hygiene for the patient. Yeah. It's more durable, and it's also more comfortable for the patient than PMMA. Yeah. As I summarize.
Yes, and also I can say it's more comfortable for us as denturists and as dentists.
Yeah, so that's something I still need to figure out, but it sure sounds like it's really better. Well, thank you, Toine, for all your information.
You're welcome.
And thank you for watching. I hope you enjoyed the presentation.